Hello everyone, so this video gonna explain to you some common conditions in the elderly. The conditions are dementia, heart failure, hypertension, diabetes, and arthritis. So let's start.
As we older, it's quite normal to be forgetful, but some people develop more serious problems and worry that these may be the first signs of dementia. But it may be the reason of stress, depression, and vitamin deficiency, and there's also something called mild cognitive impairment. Mild cognitive impairment is a problem that doesn't significantly affect the ADL. Dementia is a term that covers a several number of illnesses that affect the way brain works. It's common after the age of 65 and it affects the ADL and IADL performance.
A rural community study conducted in Selangor among Malay participants over the age of 60 found the prevalence of cognitive impairment to be 22.4%. The prevalence of dementia was 6% for an urban community study in Kuala Lumpur, 1997, among the Malay older people.
The first signs is often forgetfulness. Other symptoms include trouble communicating and confusion. Symptoms also vary from day to day. Next, there are several types of dementia. To prevent dementia, make sure you are physically, socially, and mentally active. Carer also should provide essential support and care. As dementia progresses, sufferers will need more help to keep their stress to a minimum level. For treatment, dementia is not curable, but there are medications aimed at slowing the progression of disease and symptoms.
Moving on to the next condition, which is heart failure. Definition of heart failure: a chronic progressive condition that affects the pumping power of heart muscle. Specifically refers to the stage where fluid goes out within the heart and causes inefficient pumping. The figure pictures show that the cases of disconnected users is increased from the year 2010 to 2018. In 2019, disconnected users became number one cause of death in Malaysia, which is 13% compared to other causes. It also affects 16,325 people, which 69.4% is male and 30.6% for female. Types of heart failure: left-sided heart failure, which leads to shortness of breath; right-sided of heart failure, which leads to edema; systolic heart failure, which left ventricle cannot contract properly; diastolic heart failure, which left ventricle not allowed to fill completely. Signs and symptoms: sleep difficulty, shortness of breath, lack of energy, increased urination at night, edema, confusion or impaired memory, hot with pattern, swelling or tender abdomen with loss of appetite. Next is treatment of heart failure. First is medicine, which is ACE inhibitors, beta blockers, and diuretics. And if medication is not effective, the surgery is necessary, which is angioplasty and valve repair surgery. Effect on functionality of elderly is walking, climbing stairs, and also to focus their indoor and alone. Prevention: stop or avoid smoking, active in physical activity, control blood pressure and diabetes, eat healthy food. Temporary issue: research from Napoli and Kenya in 2020. The study states that COVID-19 has implications for cardiovascular system, which will lead to various heart diseases, especially in elderly.
Hello everyone, meet Auntie Mary. She is 65 years old woman with hypertension. So, what is hypertension? Hypertension or high blood pressure is defined as persistent elevation of blood pressure. It occurs when arterioles become narrow, causing the blood to exert excessive pressure against the vessel wall and forcing the heart to work harder to maintain the pressure. Without proper attention, it can lead to complications include heart attack, dementia, stroke, kidney failure, and sexual dysfunction. According to the National Health and Mobility Survey in 2018, prevalence of self-reported hypertension in Malaysia is higher for elderly above 60 years old compared to pre-elderly. Another study states that the prevalence of hypertension is increased from 2006 to 2015. In the term of gender, there is no significant difference. Hypertension is highest among people live in rural areas, aged 60 years above, and have obesity. Hypertension may be caused by unhealthy lifestyle, family history of hypertension, and existing disease such as chronic kidney disease. It is dangerous because it develops slowly over time and there are no obvious symptoms. However, some people might feel the symptoms. There are two ways to treat hypertension. First, medical treatment. Second, lifestyle changes. How to prevent hypertension? Have a healthy diet, maintain healthy body weight, try to manage stress, maintain normal blood pressure, and stop alcohol and smoking. Look how happy she is after successfully maintaining her blood pressure level.
Diabetes mellitus. So what is diabetes? Diabetes mellitus, known as diabetes, is a metabolic disease that causes high blood sugar. The pancreas will secrete hormone which is called insulin that moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or it can't effectively use the insulin it does make. How insulin works? Insulin will help your body turn blood sugar, which is glucose, into energy. It also helps your body to store it in your muscles, fat, cells, and liver to use it later when your body needs it. So after you eat, your blood sugar, which is glucose, will rise, and this rise in glucose will trigger your pancreas to release insulin into the bloodstream. Insulin will travel through the blood to your body cells. It tells the cells to open up and let the glucose in. Once inside, the cell converts glucose into energy or store it to use later. Without insulin, your body can't use or store glucose for energy. Instead, the glucose stays in your blood. Here are the prevalence of diabetes in Southeast Asia. Types and etiology. Type 1 diabetes, which causes immune system destroy insulin-making cells in your pancreas. Type 2 diabetes, which causes cells fail to use insulin properly. And gestational diabetes is a condition in which the blood sugar levels become high during pregnancy. And there are also other types. Type 1 diabetes, or you can call it juvenile diabetes or insulin-dependent diabetes mellitus. It is an autoimmune disease. The immune system of your body will attack and destroys beta cells in your pancreas, where insulin is made. It's unclear what causes this attack. Research says that it is caused by genes and environmental factors, such as viruses that might trigger the disease. Destroying of the beta cells in the pancreas will result in the body's failure to produce insulin, and it requires the person to inject insulin. This form of diabetes usually strikes children and young adults, although disease onset can occur in any age. Type 2 diabetes, or you can call it non-insulin dependent diabetes mellitus or adult onset diabetes. It is a condition in which cells fail to use insulin properly, sometimes combined with an absolute insulin deficiency. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases the risk too. Carrying extra weight, especially in the belly, makes the cells more resistant to the effects of insulin on your blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. Signs and symptoms. The symptoms of diabetic patients are increased thirst, increased hunger, frequent urination, unintentional weight loss, blurred vision, feeling fatigue, and wounds that would not heal. The complications are retinopathy with potential blindness, nephropathy that may lead to renal failure, neuropathy with risk of foot ulcers, hearing loss, foot damage, skin conditions, and increased risk of cardiovascular, peripheral vascular, and cerebrovascular disease. Here are the few examples of the complications of diabetes. Moving on to treatment. First, you need to control your diet, exercise, insulin therapy, and oral agent therapy. So what are the effects on functioning of elderly? Numbness and tingling in hands make it harder to grip things. Blurry vision, so it is harder for the elderly to see things clearly, and patients cannot carry out everyday life activities successfully. And then they will feel sad emotionally due to weight gain and easily tired to exercise. And then they will feel physically and emotionally difficult to work while experience headache due to high blood glucose level. So what can you do to prevent diabetes, especially type 2 diabetes? First, you need to exercise, and then eat nutritious food, and take moderate amount of sugar. So for the contemporary issues, this article is telling that COVID-19 patients without other comorbidities but with diabetes were at higher risk of severe pneumonia. And then diabetes should be considered as a risk factor for rapid progressions and bad prognosis of COVID-19. So more intensive attention should be paid to patients with diabetes. Then this article is talking about fearing the primary requisite for SARS-CoV-2 virus entry into whole cells is present in higher concentrations in the plasma of the diabetic patients. Hence, it is highly possible that furin might be the major risk factor for the increased mortality of COVID-19 infected diabetes patients. Lastly, here are the COVID-19 mortality statistics in Malaysia.
Lastly, common conditions that affect elderly is arthritis. Arthritis or joint inflammations is a general term for more than 100 diseases. Arthritis affects people of all ages, with high cases among elderly. The most common type of arthritis are osteoarthritis and rheumatoid arthritis. Both causes joint pain and reduced mobility. What is osteoarthritis? Osteoarthritis is a long-term chronic disease that characterized by deteriorations of cartilage in joint, which is result in bones rubbing together due to failure in repair joint damage. It is the most common form of arthritis that affects about more than 5 million people worldwide, with women disproportionately affected by the conditions. In most cases, people are over 55 when they get it, it can cause pain and stiffness, and most common joint affected are knee, hips, back, feet, and hands. Osteoarthritis starts when cartilage start to thin or roughen. This can happen naturally during aging process. There's also things that can lead this to happen, for example, being overweight or an injury. When you have osteoarthritis, you might experience signs and symptoms like pain at joint affected, limited range of motions, joint stiffness, swelling, tenderness, bone spurs, and grating sensations. There is no cure for osteoarthritis, but there is medication that can reduce pain and also slower progressions. In severe cases, surgery is an option, like joint fusions, joint replacement, and arthroscopic surgery. Next is rheumatoid arthritis. Rheumatoid arthritis, unlike osteoarthritis, it is an autoimmune disease. This means the immune system attacks the joints, causing swelling and inflammations. Autoimmune conditions can affect any part of the body, not just the joints. According to Arthritis Foundation's Malaysia, rheumatoid arthritis affects about 5 in 1,000 people in Malaysia. Rheumatoid arthritis also more common in women and can start at any age. People with these conditions also experience swollen, stiff, painful joints which can feel warm. Symptoms are worse in the morning and after a period of inactivity. The most common joint affected are the small joint of the hands, feet, ankles. However, large joint may also be affected. Symptoms usually occur symmetrically on both sides of the body. Rheumatoid arthritis is mostly managed with medications targeting the immune system, which is aimed to decrease the inflammations and damage to the joints. In severe cases, patients may choose surgery treatment like replacement surgery, which is served to ease pain and increase joint mobility. Rheumatoid arthritis is also known to cause fatigue. Both osteoarthritis and rheumatoid arthritis will affect your functionality performance, such as restriction in social activity, difficulty performing activity daily living, problem in leisure activity, and decreased work performance. This happens due to impairment, which is joint swelling, decreased strength, limitation in range of motions, abnormality of gait, fatigue, and pain that you experience. Next is contemporary issue for arthritis conditions. The title of this article is tackling osteoarthritis during COVID-19. In this article, it stated that people with osteoarthritis commonly advised to avoid self-medications, means that they need to get treatment directly from the doctor or other professions that provide osteoarthritis treatment. But during this pandemic, people are currently not encouraged to seek for emergency or directly treatment. Restoration of daily activity may not be fully implemented in upcoming months. This situation will cause patients to not get adequate treatment for their conditions. Then, it will cause increased impairment and pain in the joint of people with osteoarthritis. According to that situations, this article provides strategies for pain relief in patients with osteoarthritis during COVID-19 that you can do at home. Lastly, if you have arthritis, try to maintain a healthy weight and keep moving as much as possible. Exercise strengthens the muscles around the joint, can improve symptoms of pain and stiffness, and keep connective tissues healthy. Taking medications can help you to stay active. Remaining physically active and continuing with your hobbies, normal routine, and social life can help you manage your condition. That's all from us about common conditions among elderly. Thank you.